Bismillah ar-Rahman ar-Rahim. Hello everybody. Welcome again to my channel. This presentation will deal with the principles of absorption and distribution in the process of pharmacokinetics. We have already said that pharmacokinetics is what the body does to the drug. In terms of absorption, distribution, metabolism, and excretion. That's why pharmacokinetic process is known as ADME, which is the first letter of each stage of the pharmacokinetic process. The goal of absorption and distribution is to deliver the drug to the site of action, to produce an action, while the process of metabolism and excretion is to eliminate the drug after it produces its action. So first we'll talk about the process of absorption, and then we'll talk about the process of distribution. Absorption is important because it is the first step in the process of pharmacokinetics. It will determine how much of the drug will reach the site of action and produces its action. Absorption is affected by many factors, including method of administration, pharmaceutical dosage form, as we will say later, third factor which might affect the absorption surface area available for absorption, and lastly is the blood flow. We'll talk very briefly and shortly about each factor. First is the method of administration. As we know, drugs are taken by different routes, and each have its own effect on the amount of drug that can reach general circulation and therefore site of action. The first very common method of administration is the oral method, which is the most commonly used because of many advantages. Why? Because the oral method is the most easy to administer. All the person needs is to swallow the drug in forms of solid dosage form like tablets or capsules, or liquid dosage form like suspension or solution, whatever. And it is cheap as well. Usually the dosage form is cheap, it needs no help. The person can do it by himself. The most important disadvantages, there are many, but I will only talk about most important disadvantages. First, you cannot give it to unconscious patient. Suppose a person is unconscious, he cannot swallow. Then you cannot use an oral method of administration. The second disadvantage is the exposure of the drug to metabolism before it can reach general circulation. Exposure of the drug to metabolism, which means breakdown of the drug before it can reach general circulation. Generally, anything which will take orally it will pass through the portal circulation or portal vein to the liver, and from the liver to the general circulation. To the general circulation. General circulation. Okay. Some of the drug will be metabolized in the intestinal lumen itself by intestinal enzymes. There are specific enzymes can break down the drug in the GIT itself. When the drug is transferred through the portal circulation to the liver, some of it will be metabolized in the liver, because as we know, as we will see, the liver is the main site of metabolism of drugs, so that little of the drug can reach general circulation. That's if we take the drug orally. This is known as first pass metabolism. First pass metabolism, because anything you take orally, it will pass to the liver first before it can reach general circulation. This is very known phenomenon. First pass metabolism, and as well it is known as first pass effect as well. First pass effect. So what will happen in this case? Suppose that we'll take 100% of the dose and only 20% reach general circulation. So most of the drug will be metabolized in the liver before it reaches general circulation. So what we will have to do in this case? We have to increase the dose of the drug in order that amount can reach general circulation in enough amount to produce an action. As we will say later, that the drug to produce an action, it should attain a therapeutic concentration at the site of action. If therapeutic concentration is not enough at the site of action, no action can be produced. Okay? So if a little reaches general circulation, that means no therapeutic effect can be produced. So what they do in this case, what they suggest, scientists, they suggest to increase the dose of the drug, so that enough concentration of the drug will reach general circulation and produce an action. Okay? Now, this is okay in normal cases, but this is dangerous in certain cases, like what? Like liver diseases. Dangerous in liver diseases. Because in liver diseases, the function of the liver is low, and therefore the amount that can reach the general circulation will be large, which can result in toxicity, overdose, toxicity. Okay? So in this case, what we have to do? Suppose that we want to give a patient a drug with first pass metabolism. In this case, we have to reduce the dose of the drug in case of liver diseases. Okay, let us take an example. Suppose that we have propranolol, the famous drug which is used in treatment of many diseases, including hypertension, ischemic heart disease, antiarrhythmia, and so on. This propranolol, it is subjected to first pass effect. Therefore, usually it is given in a high dose so that enough concentration can reach a site of action and produce an action. If the person, in this case, has a liver disease, that means propranolol will not be metabolized by first pass effect, and most of the dose will reach site of action or general circulation. So what will happen? Toxicity. Okay? In this case, what we have to do? We have to reduce the dose. This is generally done with most of drugs which are exposed to first pass metabolism, and they are given to patients with liver diseases. This is the most important disadvantage of oral administration. The drug is exposed to first pass metabolism. Some of the drugs, not all of them, some drugs are exposed to first pass metabolism, and therefore they should be given in higher doses to produce a therapeutic action. This is the first method of administration, which is the oral method of administration. The second method is the rectal method of administration. Rectal. Rectal means giving the drug through the rectum in different dosage forms like suppositories. It has many advantages, including giving it to people who cannot swallow, like very young children or infants or old people, and also it can be given to unconscious patient. To old people, we give it to old people and young people, young infants, وكذلك to unconscious patient. Rectal disadvantage. Of course, rectal will be absorbed through the rectum, through the GIT. It is exposed little, not very much, little to first pass effect, not like the oral. Some of the drug can diffuse, and after absorption it will be subjected to first pass effect. Another disadvantage, it is erratic absorption. Usually absorption is not constant from rectal administration, which will result in different therapeutic concentration. Third method of administration is the sublingual. In this case, the drugs that are taken under the tongue so that they will be absorbed directly to the general circulation and to the site of action. That means this method of administration will produce very fast effect, because it will deliver the drug directly into the general circulation. This method of administration, usually it is given in emergency, like in angina pectoris, where famous drugs like nitrates and nitrites, they are given by this method, by sublingual administration. So sublingual means giving the drug underneath the tongue, where it will be absorbed very fast and it will produce fast effect within minutes. Of course, in this case, the drug must be highly lipid soluble. Highly lipid soluble. If it is water soluble, it doesn't work. Why? Because as we have said in the last session or presentation, that only highly lipid soluble drugs can cross biological membrane. So that in this case, if it will be absorbed, it must be highly lipid soluble. The fourth method of administration is by inhalation. Inhalation is giving the drug through the respiratory tract, either to produce a general effect or to produce a local effect by different methods. To give general effect, like in case of general anesthetics. General anesthetics, they are given through the respiratory tract to produce general anesthesia, or to produce local effect, like in case of beta-2 agonists, which are used in treatment of bronchial asthma. Okay. Inhalation method offers the advantage that it is easy to administer and does not need sterilization as well. The fifth method of administration, famous, they are given by what's known as parenteral administration. That means giving the drug by injection. Of course, all parenteral administration must be complete sterilization. They are done under complete sterilization. The place of injection should be sterilized. The hands of the person who will give the injection should be sterilized. The dosage form is in sterile form as well. Parenteral administration, they are different. The most famous are the intravenous, where you are delivering the drug through a major vein into the general circulation directly. The intravenous is very important because we can give any irritant drug like anti-cancer drugs by intravenous injection. So famous intravenous injection, first advantage is given in case of irritant drugs. Irritant drugs like the anti-cancer drugs, they are only given by intravenous injection. Also, we expect very fast effect, like general anesthetics, intravenous general anesthetics, where they produce loss of consciousness within seconds. As well, it can be used when the drug has very short duration of action or very short T-half. Drugs which are metabolized very fast. The only method is to give them by intravenous injection to produce constant and steady effect. Of course, a disadvantage of intravenous injection, disadvantages, most famous disadvantage, it is dangerous in overdose. Suppose you give an overdose. If you give an overdose, you cannot reverse it. It is irreversible because it will be delivered directly to the site of action. The second method of parenteral administration, famous, is intramuscular, which is injection of the drug into muscle mass. Of course, it has advantages and disadvantages. Most important advantages is the rate of absorption can be controlled. For example, we can use aqueous vehicle for quick absorption, and we can use oil vehicle for slow absorption. This is very important advantage. Disadvantage, it is painful usually. When it is given, usually it is painful, to produce pain, site of injection. Also, you cannot use irritant drugs. Irritant drugs like anti-cancer drugs cannot be given by intramuscular injection. Third method of parenteral administration, very famous, is the subcutaneous administration. Subcutaneous administration. Subcutaneous advantage that it is easy to administer. Like in people who have diabetes mellitus, they inject insulin subcutaneously. So it is easy to administer. Once the person knows the technique, he can give the drug by himself. Most important disadvantage that low volume only can be used. You cannot inject large volume by subcutaneous injection. And also it causes atrophy at the site of injection. Atrophy at the site of injection. So these are the most famous, most common methods of parenteral administration. Next method of parenteral administration, so we talked about an oral, we talked about rectal, sublingual, parenteral, and then the fifth is the local method of administration. Local, either on the skin, application of the drug on the skin or the scalp or whatever, or to the mucous membrane of the body, mucous membrane of the body, to produce local effect. Mucous membranes, like nasal drops, which are used, very famous in common cold and allergy and so on, like eye drops, where drugs are applied to conjunctiva of the eye, or vaginal, where drugs are administered as a vaginal pessaries into the vagina to treat local infection and so on. So these are the very famous method of drug administration. Drugs that are given in different forms, including oral, including rectal, sublingual, parenteral, and local. This is the first factor which will determine the rate of absorption of drugs. The second factor which will determine the rate of absorption of the drug, which is important, is the pharmaceutical dosage form. Pharmaceutical dosage form. For example, solid dosage form, usually, they are present in different pharmaceutical dosage form, like tablets and capsules, where we'll find slow release, for example, capsules, where the drug is slowly released from the dosage form. Also, solutions and suspensions in forms of the liquid dosage form, where the aqueous form, as we mentioned earlier, the absorption is fast, while in oily dosage form, the absorption is slow. Third important factor which will affect the rate of absorption is the surface area available for absorption. Surface area available for absorption. For example, stomach is a small surface area, therefore absorption will be slow. While the intestine Intestine provide very large surface area. Therefore, most of drugs, they are absorbed from the intestine. Most of them, whether they are ionized or non-ionized. Because as we have said, the ionized form can pass through the biological membrane, can be absorbed, and then the ionized, non-ionized is absorbed first, then the ionized will be converted to non-ionized because the law of mass action, and once it is converted to non-ionized, it will be reabsorbed further and so on. So most of the drugs, they are absorbed from the intestine. Why? Because it provides a large surface area. Lungs, for example, is another example of large surface area because of lung will provide a large surface area, absorption of the drugs will be fast. The last factor which will control the rate of absorption is the blood supply. The higher the blood supply to the site of absorption, the faster will be the rate of absorption. Therefore, if we increase the blood supply, we will increase the rate of absorption and vice versa. Or decrease the blood supply will decrease rate of absorption. This is applied clinically. For example, in case of using anti-rheumatic creams, usually it is advised to rub the cream into the skin. Why? To increase the blood flow, so that increase the rate of absorption. Very famous example of decreasing the blood supply and therefore decrease the rate of absorption is the use of vasoconstrictor. Vasoconstrictor like noradrenaline like adrenaline. Adrenaline usually it is mixed with local anesthetic to decrease the rate of absorption of the local anesthetic so that the local anesthetic effect will stay in its place. Why? Because adrenaline will reduce vasoconstriction. By reducing vasoconstriction, will decrease the blood supply, and by decreasing the blood supply, local anesthetic will produce only local effect. They will not enter the general circulation. This is very important example that we'll discuss in more details when we talk about adrenergic drugs. So we said that first process of the pharmacokinetic process is absorption. After the drug is absorbed, it will reach general circulation. Once it reaches the general circulation, it will be distributed. This is the second process of pharmacokinetics, is distribution. Yet the main function of distribution is to deliver the drug to the site of action. Okay? Now, as we know, the plasma contains many proteins like albumin. It's rich many proteins like albumin. Some drugs, once they enter the general circulation, they have the ability or they have a high affinity to plasma protein. They bind with the plasma protein. Okay? So, once a drug molecule enters the general circulation, some of them, they bind with the plasma protein like an albumin, producing a complex. This is known as plasma protein binding. So what we actually have, we have a free molecule of the drug, free molecule, and a plasma protein. Some drugs, they bind with this plasma protein, producing a complex of plasma protein and the drug molecule. Now, as we know, a plasma protein, they are very large molecules. They cannot penetrate different biological membrane. They stay in blood. So in this case, once the drug binds with the plasma protein, it will form a complex. This complex cannot cross biological membrane. So in this case, only the free molecule can cross biological membrane. I don't have to remind you that only the lipid-soluble fraction of the drug can cross the biological membrane, as we have discussed in the previous presentation, because we said that drug molecules, they are present as ionized and non-ionized. They are present in equilibrium. And the non-ionized fraction, this one which can cross the biological membrane. The ionized will be converted further to the non-ionized when the non-ionized is removed from the media. So, in this case, only the free non-ionized fraction of the molecule will cross biological membrane, while the binded fraction will stay in plasma. So what is the consequence of this consequence? If the drug binds little with the plasma protein, there is no clinical consequence. Suppose we have 100 molecules, okay, plus a plasma protein. Only 10 molecules will bind with the plasma protein. Complex. So that in case we'll have 90 molecule or 90% of the drug is present free in the plasma, which can be distributed. In this case, there is no clinical significance because the free fraction is large enough to reach site of action. But suppose that we have another drug with high affinity to plasma protein. High affinity. What we mean with high affinity? High affinity to plasma protein. What does it mean, high affinity to plasma protein? i.e., it likes the plasma protein. So, once the drug enters the general circulation, most of it will be binded to the plasma protein. So we will find 90% of the drug binded to the plasma protein, and only 10% of the drug is present free. Okay? Now, so the amount that can reach site of action is only 10%. And 90% of the drug will be bounded, stored in the complex. Okay? These have very important clinical consequences. What are they? First, in this drug, which binds highly, which has a high affinity to plasma protein, will have a long duration of action. Longer duration of action. Why? لماذا? Why? Because the binded fraction will act as a store, which they release the drug slowly. Okay? So now, start again. 10% of the drug is free and 90% of the drug is binded. The 10% can reach site of action and produce an action. And 90% will act as a store, because we know by the law of mass action, by removing these 10% from the site, the equation will be derived to the left, releasing the drug, free drug, into the general circulation again, prolonging the duration of action. Okay? This is the first consequence. The first consequence, the high binding to plasma protein will act as a store that will release the drug slowly, prolonging its action. It will stay longer in the body. This is the first. The second consequence is what's known as drug-drug interaction. This is very important. This is very important principle of pharmacology. Suppose we have two drugs, drug A and drug B. Okay? Both of them, they have high affinity to the same plasma protein. Affinity, both of them, they have high affinity to plasma protein. So what will happen? Suppose I'm taking drug A, 10% only available to be distributed. Okay? 10% is free. And 90% is binded. I'm taking this drug, so in this case, only 10% of the drug is free and 90% of the drug is binded. In this case, which will produce an action is the 10%. Can reach site of action, produce an action, because it can cross the biological membrane. The binded fraction will not cross the biological membrane. So suppose in this time, I'll take drug B. Drug B as well, it has high affinity to the plasma protein. So what it will do, drug B? It will replace some of the binded fraction. It will replace some of the binded fraction, releasing more free amount of drug A, because it will replace it. Because both of them, they will compete on the same protein. Okay? So drug B, suppose that drug B will take over 40% of the sites. So drug B likes the plasma protein. So it will replace 40% of the binded fraction. In this case, how much you will have of the drug A free? You will have 50%. We'll have 50%. That means we increased the free fraction 5 times. Increase free fraction 5 times, i.e., in other words, the amount that will reach general circulation, the amount that will reach site of action, is 5 times. That means what? Toxicity. Because 5 times the concentration will reach the site of action. This is known as drug-drug interaction at the binding site or pharmacokinetic interaction. Let us say it again. Let us repeat it. It is very important to understand. So, we have two drugs, drug A and drug B. Both of them, they have high affinity to the same protein. I'm taking drug A. I'm taking drug A. Drug A. Drug A has high affinity to plasma protein, so 10%, for example, will be free, while 90% is binded. These 10% can reach a site of action and can produce action. 90% is binding, cannot produce an action. Suppose in this case I'll take drug B. Drug B, like the plasma protein, so it will say to drug A, I like the plasma protein, so it will displace some of it from the binding protein. Suppose we said displaces 40% of drug A from plasma protein. That means the free fraction of drug A will become 50%, i.e., the free fraction is increased 5 times. This free fraction can reach site of action 5 times more. So what will happen? Toxicity. This is known as drug-drug interaction at the site of binding, which is also known as pharmacokinetic interaction. Pharmacokinetic interaction. Okay? Now, very important. So drugs, once they enter the general circulation, they bind with plasma protein. Once they bind to plasma protein, some of drugs they bind with low levels, some of them they bind with high levels. Drugs which has high affinity to plasma protein, they have two clinical consequences. The first, they increase the duration of action of the drug. The second, it will be site of drug-drug interaction, which can produce toxicity. Okay? Okay, now. Drug distribution can take place to all tissues of the body, including the central nervous system or fetus. They have central nervous system, as we have said in previous presentation, blood capillaries of CNS, central nervous system, they don't have water-filled pores or water channels. They don't have water channels. Therefore, only lipid-soluble drug can enter the brain. Only lipid-soluble drugs can enter the brain. And therefore, the higher the lipid solubility, the faster the distribution of drugs into the brain. Okay. The same thing, distribution of the drugs to the fetus. Any drug which is present in the blood of the mother can reach the fetus, all of them, whether it is ionized or non-ionized. That's why we should be very careful in giving pregnant women drugs, especially in the first trimester. So this is how drugs distributed in the body. Generally, the degree of distribution is defined by volume of distribution. Volume of distribution. Volume of distribution is by its name, it's volume. The volume in which the drug is distributed. We know, if we think this is the plasma constitutes 4 liters of the total body fluid, while the intracellular fluid constitutes about 28 liters, and the interstitial fluid between the cells constitute about 10 liters. Okay, now suppose the drug has low lipid solubility, low lipid soluble drugs. Low lipid soluble drug cannot penetrate through the biological membrane. Cannot. Means that they will stay in plasma. They cannot cross into other biological membrane. They will stay in plasma. Okay? Other possibility is that our drug, it has high lipid solubility. In this case, if it has high lipid solubility, it can cross to other biological membrane, including the intracellular fluid. Okay? So, in this case, drugs with low lipid solubility, they will have low volume of distribution, while drugs with high lipid solubility, they will have high volume of distribution. Okay, so the higher the lipid solubility, the higher the volume of distribution. The lower the lipid solubility, the lower the volume of distribution. There is very famous equation which describes the volume of distribution. They say that volume distribution equals dose given divided by plasma concentration in liter. Plasma concentration of the drug in liter. Okay? We divide the dose given by plasma concentration, it will give us the volume of distribution. The higher the volume of distribution, the higher the lipid solubility, because the drug can penetrate through different biological fluids لحد it reaches intracellular fluid. The lower the volume of distribution, the lower is the solubility of the drug. So we have explained briefly the process of absorption and distribution. I hope that you have gained information about these two processes. After the drug is distributed, it produces an action. After producing the action, it will be eliminated. This is the third process of kinetic elimination, which we will talk about it inshallah next presentation. Thank you very much for your attention. I hope you to stay in peace and harmony. Wassalamu alaikum wa rahmatullah wa barakatuh.